Hello, I want to speak to you briefly about the disorder called spasmodic dysphonia, and the focus of this video is the adductory, the adductory variant. And just to begin with, the disorder is neurological, but with a small n. Capital N, neurological, is scary. It's brain tumors, it's seizures, it's strokes, it's bad things. Small n is the kind of neurological disorder that has no effect whatsoever on your general health or on your lifespan, but it interferes with some sort of function. And in the case of spasmodic dysphonia, it's with the voice that it interferes, and occasionally breathing. Now, it's a movement disorder, neurological, not psychological, not functional. It's neurological. It's a movement disorder. Dystonia means abnormal tone in muscles. So you might have encountered someone in a public place who blinks excessively like that, or they seem like they're squinting all the time and blinking. That's dystonia of the eyes, ocular dystonia. There's also one where the head might be turned or twisted or moving like this, and the person can't really straighten up their head. That would be dystonia of neck muscles. There's one where it affects the hand. The hand begins to jerk uncontrollably, especially with certain tasks like writing their name and so forth. That would be limb dystonia, but we're talking about laryngeal dystonia. The effect of the laryngeal dystonia is on the voice primarily, and so the disorder primarily goes by the name spasmodic dysphonia. Phonia is sound, spasmodic dysphonia. And so the cause is genetic, but it often skips generations, so your children may not be affected. It skips generation quite frequently. It has what's called low penetrance. So there may be people in your family who have the gene, but it was never turned on. I believe the estimate is 1 in 50,000 people in the general population, and about 1 of 20 with dystonia have a family member with dystonia. So it is genetic. The varieties, the basic varieties, are the adductory, which was what I mainly want to focus on here. The adductory is when the vocal cords, which need to come together in a smooth and appropriate level of pressure with each other, they develop these spasms where they squeeze too tightly in a sustained way, so the voice becomes kind of strained like this. That would be just the tonic variant, or it has what are called phonatory arrests, where the voice just catches and stops suddenly. So that's fairly pure, just phonatory arrests. And if we put them together, you hear the strain, and you also hear the gaps or the cutouts of voice like that. So that would be a kind of classic with both strain and phonatory arrest. And rarely, 1 out of 50 or so, there are some respiratory effects. Instead of air coming in smoothly and going out smoothly as we breathe, it comes in jerks, or it goes out in jerks. And once in a while there's some tremor involved as well. So the voice has a kind of a shaky quality like this. You hear the e, but in addition it's not just e, but it's e. So there are the interruptions as well. Well, what about treatment? The mainstay, in my opinion, remains Botox. Speech therapy deserves comment. In clinics where physicians don't teach you much, don't tell you much about spasmodic dysphonia, the speech pathologist serves a wonderful educational role to help you understand the disorder, as I'm trying to help you understand now. So that's one role they have. And the other role is to help you with your circumstance, life circumstance. If you're a teacher, how do you manage the classroom? Are there any things you can do to make things easier? Now, they do work on the voice itself, and I would say sometimes they find little what are called phonatory tricks, or like using a very higher voice, or or a very sing-songy, reading to children voice, and that might mute the problem a little bit. But in my experience, the speech therapy doesn't really fundamentally alter the problem of the voice. It just is sort of supportive. Now, some might disagree with that, but that's how I view speech therapy. Surgery, there's a long list of surgeries. I could spend quite a bit of time talking about the history of the surgeries for spasmodic dysphonia, but the main one that I think is still on the table is called SLAD-R, selective laryngeal adductor denervation and reinnervation, SLAD-R. And it's a big subject, so I'm going to leave it pretty much to the side and just say it's an option, but if it's me personally, if I can get good results with Botox, that's what I'm going to do. Well, what should we say about Botox? The first thing is you need high-quality injections. What do I mean by that? Number one, available on demand. When you have spasmodic dysphonia, when you need help with Botox, you need it when you need it. You can't be told our next clinic is a month from now. If you've got a speech to give unexpectedly the next week and you need Botox, then it should be available to you. Here at Bastion Voice, the 3 physicians can give you treatment any day of the week pretty much. And so we try to fit you in fairly quickly when you need us. Available on demand as much as possible. The procedure needs to be fairly slick. So, you know, there could be a shot given in your arm in a sort of a smooth and elegant way. There could be one where it's like, you know. So here we try to do it in an elegant way as best we can. You don't want to feel like a pin cushion or have a big bruise every time you get the Botox injection. And by the way, the idea of a shot in the neck is very troublesome to people, obviously. But I would just say if you can do a shot in your arm, you will have no problem doing this Botox shot. It's a little icky, but it's very quick, and you can definitely do it. The third issue, so on demand, done kind of elegantly as possible, and the third is to narrow the variability. You want to feel that each time you get your injection, it's going to work. Why can we not give you precisely the same result each time at the same dose? It's because we can be good at getting the needle into the muscle, but when we push the plunger, we can't determine exactly where the medication is going to diffuse. It comes out the end of the needle and it kind of spreads through the muscle, and we can't determine that. So the idea is to narrow the variability. At the same dose, you may say one seems slightly stronger than the other, and have slightly different, but you should walk out feeling highly confident that it's going to work every time. A narrow variability. Well, if you need resources, go to Laryngopedia. There's a major amount of information about spasmodic dysphonia. Just type in SD. And the other place is Dysphonia International. Dysphonia International, their website is www.dysphonia.org. That's a wonderful resource for people with spasmodic dysphonia. Well, that's an overview, as I said, and I hope it's been helpful, and thank you very much for listening.